Hey, good morning, NAF El Centro. Captain Perkins here. I'm with our Public Health Information Emergency Officer, Lieutenant Basaran, also our base flight doc. We're going to talk to you a little bit about what's been going on with COVID recently and how you can best protect yourself as we work through this. So, Doc, thanks for joining us. Up front, I do want to say that we are in a much different place than we were 6 months ago. We are now a vaccinated force. So my approach to each of these challenges is we will persevere through them while managing risk. We will keep services open to the best extent we can, and we're not going to go into lockdown and turtle up like we did last year, which was appropriate at that time, not necessarily warranted based on what we're dealing with today. So let's talk about what are we dealing with today? What's been going on recently? We hear about Omicron a little bit. How's that affecting us on base, and what should people do if they're feeling not well?
Yeah, so right now we are seeing an increase in cases both on base and off of base, and we also are still advising all of the same advice of mask up, make sure you're wearing your mask over your nose and mouth. I know sometimes people don't want to, but please do. Continue good hand hygiene, wipe down, sanitize high contact areas, and make sure that you're doing some, before you go into work in the morning, that you're taking a look and saying, am I having any symptoms? Do I feel like I have a sore throat, runny nose, cough, headaches, body chills, fevers, anything like that? Give your employer, your chain of command, a phone call to see whether or not you should come into work that day.
Yeah, a couple key things there. So continue your daily health screens. Continue wearing masks when you're indoors. When you're outdoors and spread out like we are now, it's okay to demask if you feel comfortable with that. But on your daily screens, if you're not feeling well, do they call medical or what do they do?
So please don't call medical. We actually have a list of symptoms that have been sent out to everybody on base. And if you're having any of those symptoms, it is appropriate to get tested for COVID-19 and stay home in ROM until you have those test results.
Okay, so let's talk about ROM. So ROM is adjusted throughout the course of this disease, and our policies have adjusted accordingly as well. So what is the current guidance for ROM, whether you're vaccinated or you are awaiting an adjudication on an accommodation request?
Absolutely, great question, sir. So right now, if you are symptomatic, we are asking you to ROM until you have your test results. So anybody with symptoms should get tested.
Regardless of vaccination?
Regardless of vaccination status. Now, if you are exposed to somebody but don't have symptoms, that's kind of based on your immunization status. So if you received the Moderna or Pfizer vaccine within 6 months, or the Johnson & Johnson within 2 months, or have been boosted, you do not need to ROM if you are asymptomatic. Now, if you got your vaccine outside of those windows or have not been boosted, we do recommend that you ROM, stay home, and get tested. Now, that being said, if you were vaccinated or had your booster, we are still recommending, even though you don't have to ROM, that you get tested at day 3 to 5. So day 0, we're considering to be your date of exposure. So through day 3 to 5, we are still recommending you get tested.
Okay, so there's a lot to unpack there. We've tried to simplify that with some flow charts that explain it. It's been pushed out to base leadership. We'll make those available through all of our social media sites as well. Bottom line is, if you test positive, regardless of your vaccination, ROM until you're symptom-free. About 5 days is what we're calling right now. And if you're feeling unwell, if you're symptomatic but haven't necessarily gotten that positive test, it's going to kind of depend on your vaccination and what you're experiencing. So refer to the medical guidance, follow the flow chart, work with your chain of command, and if all that's not answering your question, then contact medical. We'll get some expert advice in there for you, but that's being provided. A couple other things I want to mention. What I've gone to on base is a kind of a virtual meeting posture right now. So we're trying to minimize contact between folks indoors. We think we've got a couple of weeks. Numbers are climbing across the nation. We've got a couple weeks for this to burn through, so we're going to take some extra precautions to manage that problem for the very near term. If you are living in one of our base houses or NGIS or barracks rooms, remember that if you do test positive or are feeling symptomatic, inform your chain of command, inform our housing team so we can put the appropriate signs up to notify people to protect themselves as they're moving in and out of buildings. We have these available at the front desk. Each of your chain of command has those as well. So let's make sure we get those posted just to keep each other safe. Okay, So moving forward, I'm not making any changes to the base policy as far as services. Commissary, NEX, the food services, all that's going to keep working. We're asking folks just to be diligent about your spacing when you're inside. We're going to continue indoor dining because we've got our hands around that. We are going to make a change. We're going to close indoor use of the bar. We're going to move that to the outdoor patios. I think that's going to be a safe mitigation plan. And then we're also making a tweak to the gym. We're going to allow some periods of time per day for active duty to go by themselves and not worry about exposure or contact with other folks that are outside the military. We still will have some hours where all authorized users have access to fitness as well. And then again, outdoor, really low risk. We're keeping all the outdoor stuff available. Nice day like today, it's great to get outside. Again, we're a vaccinated force. We've got good plans in place. There is a little bit of an uptick right now. You keep doing those daily things. Don't come to work sick. Avoid close contact with each other. We'll get through this, but we're going to do it in a manner that's a little bit different than before. We're not going to shut everything down and lock it down. We're going to work our way through it safely.
Yes,
anything to add at the end,
No,
Don?
sir. You hit
Okay.
it all.
Thanks very much. I appreciate everyone's diligence and accommodating and following those rules. Keep each other safe. We'll get through this and have a great day.